What are the latest research findings on depersonalization? Have you ever felt disconnected from yourself or your surroundings? This feeling, known as depersonalization, is gaining attention in recent research, especially concerning post-traumatic stress disorder and related conditions. Recent studies have shed light on how depersonalization is linked to various mood and anxiety disorders. One significant finding from a 2025 study shows a strong connection between depersonalization symptoms and separation anxiety. Patients with higher levels of separation anxiety reported more frequent and intense depersonalization experiences. This study also highlighted that derealization, a related symptom, was closely associated with suicidal thoughts and behaviors. A specific type of depersonalization, called autopsychic depersonalization, where individuals feel like outside observers of their own thoughts, was particularly linked to increased depression and suicidal risk. This emphasizes the need for healthcare providers to assess depersonalization symptoms in patients with anxiety and mood disorders, especially if they also experience separation anxiety. Epidemiological data reveals that clinically significant depersonalization occurs in about 0.9% of the general population. It is more prevalent in individuals with co-occurring mood and anxiety disorders. Importantly, depersonalization is not limited to a single disorder. Instead, it often indicates a more severe or complex clinical state. This suggests that depersonalization may serve as a marker for illness severity rather than a standalone disorder. Emerging research also points to depersonalization and derealization as transdiagnostic phenomena. This means they can appear across various psychiatric disorders, including anxiety, depression, and psychosis. Researchers are exploring whether directly targeting these symptoms through specialized cognitive behavioral therapies could enhance treatment outcomes for individuals across different diagnoses. A feasibility study is currently examining a cognitive behavioral therapy specifically designed for depersonalization and derealization disorder, reflecting a growing interest in tailored treatment approaches. Additionally, there is increasing recognition of the neurobiological changes associated with depersonalization and derealization, particularly in individuals with complex trauma histories, such as childhood sexual assault. Innovative therapies, like dance and movement therapy, are being studied for their potential to address these disruptions by helping individuals reconnect with their bodies and integrate their self-experience. While these approaches show promise, they are considered adjunctive and should not replace established trauma-focused treatments. In summary, the latest research highlights depersonalization as a significant symptom that often coexists with PTSD and other mood and anxiety disorders. It is linked to greater illness severity and suicidality risk, making it a valuable target for new treatment strategies. Continued research is refining our understanding of its mechanisms and effective interventions, emphasizing the importance of comprehensive assessment and personalized care for those affected by PTSD and related conditions. If you or someone you know is struggling with these symptoms, it is essential to consult a healthcare professional for personalized advice and support.